Basophils are the rarest of the white blood cells, composing less than 1% of circulating leukocytes. Their primary action is to be inflammatory. Their granules can then attract other leukocytes to leave the blood to enter an inflamed tissue. Under normal conditions, basophils do not enter the bronchioles. They are not attracted to it, although in asthmatics, basophils can leave the blood and enter the bronchioles and take up residence. Basophil numbers are increased in asthmatics and tragically are noted to be higher in cases of fatal asthma. Basophils can release their granules, which are full of components which can cause inflammation, like histamine, which can cause fluid to build up in the bronchiole, and signaling molecules like leukotrienes and cytokines, which could track eosinophils to the area, or to stimulate T helper cells to become more inflammatory. This is something that the interleukin 4 and 13 signaling molecules do. Interleukin 4 and 13 are those which stimulate B cells to undergo class switching and release the antibody IgE. There are different kinds of antibodies, and when IgE is made instead of, say, IgG, this promotes inflammatory responses because IgE can bind to the cell membranes of mast cells and basophils. And when an antigen binds the antibody, it causes either the mast cell or basophil to release inflammatory granules. So basophils can help encourage the production of IgE, and then along with mast cells can be the cells which actually bind IgE to cause inflammation. As T helper cells mature, they can become more proficient in the Th1 pathway, where they help fight infection, or the Th2 pathway, where they promote inflammation. If a preponderance of T helper cells develop along the Th2 pathway, this will increase the levels of inflammation and aggravate asthma, making asthma more likely. Basophils interact with the T helper cells and help them mature through their local hormones. And basophils encourage T helper cells to develop along the Th2 pathway. In fact, it is thought that basophils may be an antigen-presenting cell, so that they can present an antigen to the T helper cells as they mature and give them interleukin during the process. Not only might basophils be an APC, they might be the major APC of the Th2 pathway, encouraging the T helper cells to promote more inflammation, which will worsen asthma.